Thanks so much for letting me do my first video. As outlined previously, I'm the foot and ankle orthopedic surgeon. My name is Stephen Kent. I work as a foot and ankle orthopedic surgeon locally here in Newcastle. Here's my website, YouTube channel, where you can find some informational videos regarding foot and ankle injuries and surgery. And we also have a website that shows similar surgeries, information, and a blog. Please go back and look at our first video for the pickers regarding diagnosing a syndesmosis injury. Just to remind you all what a syndesmosis injury is, it's an injury to the ankle, usually an area which is in line with the fourth toe. We're going to draw an ankle just from the front here as we did in our last video, just to remind you of the bones and what might be injured. So we're going to draw the shin bone just there, known as the tibia. Next to it is your fibula bone, which takes about 1/8 of your weight. We're going to mark further down your heel bone, which is at the bottom there. It's otherwise known as the calcaneus. And then a little bit further up from that is a bone known as the talus. It's a square one there just underneath the tibia. It's the one that gives you your movement to the ankle. So these are the bones that you'll typically find in the ankle. And the syndesmosis is that red area there, those lines there or ropes that connect the tibia to the fibula. And that's the area that's injured when someone says you've got a syndesmosis injury. That's it in real life there. And we're just going to very quickly mark out the tibia, fibula, talus, and heel bones in real life, so you get a picture of where they might sit around your own ankle. The green ligaments things there are ligaments further down that you typically injure in a low ankle sprain, and it's not relevant to a syndesmosis. It's not the same injury. So as we said in our last video, Patrick Mahomes is a great illustration of a syndesmosis injury. In the shot on the left there, he's just about to stand on his leg, but there's been no injury happen. And then as the player that's holding his leg pulls down, his force goes through the leg. His leg is pulled in one direction, and his foot is pulled away from his body or turned away at the same time. And that's the typical mechanism for how you do a syndesmosis injury. Unfortunately, that talus, that square bone, is driven into the fibula when you do that, and that creates a lot of tension over the fibula. Generally, the tibia, so your big bone there, is driven in the opposite direction, and that results in a busting of the ligaments between the tibia and the fibula, and that results in some pain in line with the fourth toe at the level of the ankle. So today we're actually going to talk about how someone like myself works out how bad the injury is and whether it might need surgery, and that's known as grading. And in grading, basically tells us, as we said, how bad the injury is, and we're referring to those red ligaments there once again. But I want you to try and imagine this time that you're looking at that red area from the bottom up. And when we do that, we sort of see the tibia is on the left there, has a groove that sits for the fibula bone on the right, and the syndesmosis, or those red ligaments, are actually 3 ligaments. One at the front in red there, one at the back in blue, and another one at the back in green. Now the front one is known as the AITFL, the middle one is known as the IOL, or interosseous ligament, in blue there, and the back one is known as the PITFL. And essentially how many of these things you bust makes or breaks what grade you have. So grade 1 typically means busting the AITFL, or the red ligament at the front, and most patients with just this often get away without surgery. They may need a fair bit of physio, they may need a boot for a short period of time, but generally you'll be back somewhere between 5 to 6 weeks, more often than not. Most injuries we see are at least what we call a grade 2, meaning you bust the red one at the front, which is known as the AITFL, and the interosseous ligament, which is the one in the middle. But your green one, which is the back ligament, is intact. And in these injuries, more often than not, there might be some instability, meaning the fibula is moving too much, which can cause you ongoing symptoms. And in many cases, we're recommending what's called an ankle arthroscopy, so looking inside your ankle to see if the fibula is moving too much and whether it needs to be stabilized. A grade 3 means you bust all 3, and it's the more serious one. And in those, generally, we're also recommending an ankle arthroscopy. This means that you bust the AITFL at the front, so the red one, the middle one, known as the interosseous ligament in blue, and the green one at the back, known as the PITFL. More often than not, we will find that the fibula is moving too much in these injuries, but we still double check with an ankle arthroscopy, which means a camera into the ankle. And if it's unstable, then we'll put something in there to keep it in the right spot. So usually grade 2 and grade 3 are the types of injuries where we're recommending surgery. If you have a grade 1, just an AITFL, then generally not. The red areas there are where the ankle arthroscopy is done, so the 2 little cuts you'll typically find. And during that surgery, we still usually stick a little probe between the 2 bones, and that probe shouldn't go in there if the fibula is stable and moving as it should. If we can get the probe in there, then it's unstable, and we probably need to put something in to keep the fibula from moving too much. And that is known as a syndesmosis stabilization. And so typically that involves what we call a tightrope, which is that device you see on the left there. We drill a hole across the 2 bones, and something called an internal brace, which essentially recreates the front ligament. So the tie rope there is in yellow there. It's a synthetic fibre which goes between those two buttons, and the internal brace goes in this direction here, which we've just drawn. And that construct there is just about as strong as what you're made with from a syndesmosis point of view, and that allows us to let your weight bear in a boot straight away and generally get out of a boot within 2 weeks. It's a very predictable injury, and most patients in a professional setting are getting back around 5 or 6 week mark. Anyone outside of a professional setting is usually somewhere between 6 and 12 weeks. Please make sure you tune in to take a look at some of our other videos. We've got them suggested here. Alternatively, you can subscribe to our YouTube channel. Thank you so much for letting me sponsor the pickers this year, and we'll create some more videos as the year goes on. Thanks.